It is my absolute pleasure to introduce our distinguished guest today, Dr. Mohammad Ather Shafique. Dr. Shafique is an accomplished medical professional with an MBBS from Xi'an Jiaotong University, China, and a master's in advanced health services management from Griffith University. He currently serves as the Health Information and Practice Manager in Brisbane, Queensland, bringing a wealth of experience in healthcare leadership, medical education, and practice management. Over the years, he has been a mentor and guiding force for countless aspiring doctors. In today's session, Dr. Shafiq will walk us through essential topics such as AMC eligibility and exam structure, registration and fees, proven preparation strategies, clinical exam tips, life after AMC, visa and relocation guidance, career opportunities, common challenges, and his own personal journey of success. So get ready to take notes, ask your questions, and learn directly from someone who has successfully navigated this path. Dr. Shafiq, it's an honor to have you with us today. Over to you, sir.
Okay, guys. So my name is Mohammad Ather Shafique, or in fact, like you can call me Dr. Mohammad Ather Shafique. I did my MBBS from People's Republic of China from Xi'an Jiaotong University, and then I went back to, and I think I worked for 1 or 2 years up there, and then I came to Australia for my masters. I started my journey from Perth, at Curtin University, and then from Curtin I moved to Griffith, and since 2018, yeah, I came to Australia in 2017 June or July. Yeah, I think it was July. Sorry guys, it's pretty like 7 8 years ago, so don't remember much. And since then, been in Queensland and finished my masters, and from 2020 I have been working into management and in the general practices. And at the moment, I'm working as a health information manager and a practice manager. I have around seven practices under me. And so that's bit. And with those practices, I'm also preparing for exams. And that's just a brief introduction about me. Open and up to you guys. So if you have any questions, feel free to ask. And I would also really would appreciate your uh, team who's got this idea and they thought to arrange this session for you guys. I'll try my best to help you guys with best of my knowledge and capacity. And because frankly, knowledge is power, and I didn't have the guidance when I came to Australia. So, but hopefully, you guys will have this information and will make a very good and better decision for your future. And may God with you, all of you guys, and you all be succeed in your fields. And let's start the session for today.
So, sir, to start with the first question, what are the different pathways to meet the eligibility criteria for practicing medicine in Australia or for setting the AMC exams?
That's a very good question and a very essential one. Technically speaking, there are three different pathways, but for medical graduates like you guys, which I think you'll guys be done in 1 or 2 years. So for you, it's only one pathway, that is competent pathway or standard pathway, in which you have to give exam and pass AMC one part one, sometimes part two. Sometimes if you're lucky, there's another pathway that comes after part one, the work-based assessment, in which you are exempted from being given part two, and you work in a hospital and you are assessed in the hospital field. So getting to the second point, anyone who is having a degree from a university that's in ECFMG, under the ECFMG, that's Education Commission for Foreign Medical Graduates. I think this is a US body, or WTOMS, that's the World Directory of Medical Services. And so hopefully your university will be listed in any one of these bodies, and once it is listed, you are eligible to give AMC exam. If it is not listed, unfortunately, you're not eligible to give exam. I'll briefly touch other pathways too, like they're not relevant, but like let's go through it. So the competent pathway is for mutual recognition. Mutual recognition is like they are, if you're a graduate of UK, Ireland, Canada, USA, New Zealand, you are exempted from AMC exam. So you can apply as a by mutual recognition or as a competent pathway. Uh, you need to have a valid license of these countries, and like I think these countries they provide you license only if you work there. Like passing PLAB 1, PLAB 2 won't make you eligible for this pathway. You need to have a work experience from there. And specialist pathway, like too early for you guys. It's just like you need to be specialist in your field. Every specialty isn't accepted, and every specialist is not considered specialist. It is you need to contact respective colleges like gynae ops college, surgery college, ophthalmology college. So Australia is a bit different as compared to other institutes like countries like USA, UK. So in UK we have MRCP, like the Royal College of Physicians. I think that's what. And so, but in Australia it is like these colleges they take care of their graduates and or the specialist, and so you need to contact them. They will assess your documentation, they will assess your skills, they will assess your work experience, and then they will tell you your pass fail, like half pass, or like if you need to work, how much you need to work under supervision, and then you need to give, I think, the final exam, and then you will be considered for the specialist pathway. And that's you need to what you call that, contact every relevant Australian college for that. There is another pathway, that's a pesky pathway. Again, that's after part one, but again, that will include your, that's not for the fresh medical graduates, it is for those who have experience and extensive experience. Then you will eligible to work in that, and then part one, pesky, then they will assess you, then again they will tell you what and what not to, and you'll have to work in some area of need, which will be like not main city but a smaller city and like that kind of scenario. But I think that's not at the moment relevant for you guys, so you just guys need to focus on part one, like competent or standard pathway, that is AMC part one, part two, and then you can become a what you call a full licensed doctor in Australia. And the second year, before I forget, like when you do that work-based assessment or WA assessment, WBA, in that you will have, after passing part one, you will apply for a job or like work-based assessment. It is very less and only provided by few hospitals. And then you will get a provisional license and you have to work for a year, and then you'll be assessed in the hospital, and after that your provisional license will be converted into a full license. Yes, Ahmad, I think hopefully that would have answered.
Moving on to the second question, how is the AMC exam conducted and could you explain its structure and format?
Mhm. So AMC part one, MCQ exam. So in that they uh, test you on the final year subjects, like the clinical subjects, including medicine, surgery, psychiatry, ops, gynae, public health, public health, including epidemiology and biostats, and ethics. So these are the major portions, and there will be 150 questions. And out of 150 questions, it will be 500 marks. And out of 500, you need to get 250. And the division will be like out of medicine, it will be like 30% questions from medicine, 20 from surgery, 12.5 from gynae and obs, 12.5 from peds, 12.5 from psychiatry, and 12.5 from biostat and epidemiology. And you can also say like public or like ethics and that kind of a stuff. Questions will be extensive. They have a very long stem. They differ from the questions that are usually done by the USMLE. Like USMLE, it is like for part one, I think it is straightforward question, like one-liner. But in this part, it is not a one-liner. It's extensive 3-4 liner question. Then they try to turn and twist, and then there's like 5 options, and you don't know what is the mark of that question because every question has a different mark, and the marks depend on the complexity and the difficulty level of the question exam is set by or you can say like controlled by computer and AI. So like they will do, you get question one, you answer that, so the next question will be related to the same topic, a difficult one, you answer that, a third question will be related to that one, and that will be like the kind of more difficult than that, and will be higher percentage or marks. uh, so as you go higher, your marks will go higher. You answer the question, it is wrong, so it will take you a new topic. There is no what you call that mm, preferred, or I would say frankly uh, recommended. They do suggest, AMC do suggest few books and stuff, but they won't like emphasize, or they would say like do this and it will be good. So there is no one solid book or like books for the preparation of the exam. But key part is sticking to the guidelines of Australian guidelines. So that would assess you guys and help you guys to prepare. And yeah, we'll go. I think we'll talk about further points, or I'll just note it down. If not, then I might share it about at the end.
All right, so let's move to the next question. What should candidates expect in the AMC exam? Is it OSCE based, and how many attempts are allowed for each part of the exam?
Uh, I would say clinical. It is a far jump for you guys, but still like that's an OSCE base, so it will be like uh, 16 plus 4, so it will be assessed on 16 stations. Now I think they're changing to 14, and you need to pass 4, and 4 stations are rest stations, so like they are not marked, so it is just to gather your courage and just relax and do. So it is like 10 minutes each station, 2 minutes to prepare, and 8 minutes for the task. And it's like same skill test, still like history taking, physical exam, diagnosis, management, communication. uh, so either it will be 9 by out of 14 or 10 by 14. So it's not finalized yet, but I think it will be most likely 9 out of 14. And number of attempts, at the moment there is no specific restriction on that, but I think they are like going to bring some restriction. Like they are like there's rumors going on there. They will, for clinical, it will be like 4 attempts per eligibility period. So maybe they might be linking their AMC part one with the eligibility period, like they do for dentists. Like if you pass part one, you have like 3 attempts to pass part two. If not, then you have to go back to part one and then give an exam for part two. So we're good.
Moving to the next question. How can a candidate register for the AMC and create an AMC account? What are the fees involved, and are there any scholarships available for potential candidates?
Okay. So I think I'll be able to share you a file with you. Just remind me in few days' time. That file has like a whole process. It's not like a 1 day process. It takes a bit of time. Like first you need to create an account with ECFMG. You need to submit all of your credentials to them. then they will send that degree to your university. So if you're leaving your university, be good with the juniors so they can help you and process your degree from the university office on a like much earlier, as compared to like just sitting there and the office takes its own time to complete it and stuff. So ECFMG will assess your documents. The ECFMG will ask you to nominate a medical institute, will nominate AMC. Once it is done, your documents will become to AMC, and then AMC will, like, I think it's around $500 or something to create an account. So because I think I had done it 2 years ago, so I'm not good with the numbers. Like, I can't give you the exact numbers at the moment, but I think Epic, the ECFMB verification, and and I think it will be around 15 to $2,000 Australian dollars. That will be around thousand US dollar almost. And these are just a rough estimate. I can't remember exactly. So just when you're planning to do, so just keep in a rough estimate in your mind. And like, no, I don't think so there's any medical what you call that body or those offer scholarships for the examination. So frankly, there is no exam scholarship for you. If you want to come and do the exam, there is no scholarship. For the specialization, very rarely you're being offered, but not much. Like, I know, like in China, they do offer specialization scholarships, but not up here. And it's because I think the offer is just because of the research based, and more the PhD scholars or the research paper they publish, the higher their value or like the name grows. So, but that's not the case up here. So, no scholarships available.
Okay, so let's move to the next question. How much preparation time does a candidate typically need for the AMC? What resources should they follow? And are there any online academies available for AMC preparation?
Mhm. Okay, so we're talking about it depends if you are working, if you're not working. If you're not working, I would suggest 3 to 5 months will be good enough. But if you're working, uh, make it 6 to 9 months for AMC Part 1. Excuse me. Uh, Clinical, again, if you're working, 6 to 9, not working, 4 to 6 months. And that's including like if you take some mock OSCEs and stuff. So that that's included. Uh, so recommended resources. So there is an AMC handbook of multiple choice questions. It is recommended, like suggested by them. Then there's a John Mortaj General Practice book. It is different to all the Davidsons and Oxford, and I forgot the other one name. So, but it's written by an Australian style, so it is difficult. It's different. You can have a look. You might find a PDF available. So, Australian therapeutic guidelines. It's not available in a PDF copy. It's like the website. You need to buy a membership. Like, I think 300 Australian dollar. You get 6 months membership. Some people do use Oxford Handbook for Clinical Medicine, Kaplan, MTB, Master the Board. But the Master and Board, this is just for what you call that, not a main book. It's just like as a referral book or that kind of a stuff. And about online courses, yeah, there are few available, but as I wouldn't take a name of anyone, because if I take a name of someone and people find that not good and the other find good, so it all depends on your choice. So there's few Dr. Shahriar Ahmed, he's from Bangladesh. Dr. Ahmed, he's from Pakistan. He's doing from Australia. For this first aid, first aid that's also run by, I think, from India. Emergency focus, that's also run by India. in Pakistan, like, and from Lahore, there's a DIMS, Doctors Institute of Medical Sciences. They are running a course. So there are a lot of it. So just see whatever is suitable. Yeah, important topics. They will like they're like important topics are same everywhere same. Heart attack everywhere same. Cardiology everywhere. It's the same issues. So these are like the same issues that you're learning in university. You will be practicing all those things the same. What different will be ethics. It is ethics, privacy. This is not taught in our countries, but that's a total ball game in Australia. So you need to be very careful about ethics, privacy, and these kind of stuff.
Okay, sir. Up next, what are the clinical exam dates and what common mistakes do most candidates make during the clinical exams?
Uh, one will be like time management, common mistake, not familiarity with the Australian system, rushing between the systems and missing key diagnosis, and incomplete communication. Not explaining those Australian like complete steps, and again familiarity with the Australian guidelines. That's like one of the major drawback or lacking that's seen in the students. Because I'm not familiar with the system in the way you are studying. Like up here, LGBT and these kind of social issues. So I was talking about the issues like cultural issues like here LGBTQ plus. So you need to be very sensitive about these issues. You can't show your liking and disliking in this regard. And then again, it will come about too because Australia has a very complex history. So Aboriginal people, uh, so they have a different modus of operandi about them. So it is it's a bit difficult and bit different terrain as compared to other countries. So these are the issues that you need to be very familiar, and empathy. It is very important. Like in empathy, you can say your approach, your friendliness, and your professionalism. That's very important. Uh, one thing is of guarantee that unfortunately in our side of country or in our side of part of the world, including like all the countries, so we have, I would say, like ego massage. It's a very prominent thing of ego massaging. Like the professors, they feel you for like not calling them sir and that kind of hierarchy system. And but this kind of thing is not, I would say, not allowed up here. Here, everyone is respected, everyone is taken care of, and everyone is given equal respect. Uh, I have been working with a lot of doctors and very highly professional doctors, and some of my professors, one of that professor, he was a key member of Australian health policy. So, but he didn't like calling being called like as a professor or something and something. He just told us to like just call me by my name. So these are kind of a things that we need to be familiarized. Like Australian people are, they're very so like easygoing, but they are very sensitive too. So this is kind of a very tight rope that if you are not um, like in the system and you don't know the culture, it is a very tight rope to walk on. uh, yeah, I think yeah, here we're good. Yeah, we're good with that.
Moving on to the next question, what are the next steps after passing the AMC clinical exam? How does provisional registration with AHPRA work, and how challenging is it to secure an internship or supervised practice position in Australia?
Okay. My prayers and best wishes for you guys to pass the exam and be part of Australian beautiful health system. Frankly, I've been in discussion with people from US, and I always ask them, what's the difference? Like, why? And people, they do accept that their health system isn't that best or isn't that prominent, although it is like shown and told in media and stuff, like the Australian American health system is best. I have a friend in US, and he's not a doctor, but he had an old parents. So I asked him, I said, like, why don't you move to another state? He said, yeah, if I move to another state, those states, they don't have good health policy for their health insurance policy for the elders. But this state, it is expensive, but it has a good health insurance policy for my parents. But on the contrary to Australian system, everyone who like becomes kind of a permanent residence, they get a Medicare. With that Medicare, you can go to hospital, any government hospital, and you'll be treated in a similar fashion, like maybe a manner. I had a small incident. I had to go to hospital. Yes, my emergency were busy, and my turn came around after 13 hours. Like I went around 4 o'clock in the afternoon, and I think I got admitted in the hospital around 5 o'clock in the morning. but I but I got on my own bed. I was given the meal that I wanted. As I'm a Muslim, so I ordered, like, so told them I want a halal meal, halal meat, and I was given halal meat uh, 3 times a day, very good breakfast and tea and all that stuff, and not a single penny was charged. And they did an MRI and all the stuff, not a single penny. And even some cases, hospital also arrange you pickups and drop offs, so each and everything. So uh, this healthcare system is one of the beautiful healthcare system. We can argue and dispute about delays in the emergency, but that's the system. They do the triage following, and anyone who can bear the pain can wait. So that's a different story. So I was just trying to connect it. Uh, Again, after passing part one, part two, inshallah, you'll be getting APRA registration. And I think APRA registration costs you around $800. Yeah, around $800. And visa cost, it varies. So which visa are you coming? Yeah, on which visa are you coming, and who's coming? Like if someone is sponsoring you, like if some medical practices are sponsoring you, mostly they pay the visa fees. If they don't, then you have to pay it, and it all depends. Recently, they increased the visa fees, but trust me, once you get those things done, that money will be easily recoverable, like in 6 months max, 6 months to 1 year. So it won't be that difficult. Getting okay. Internship will be competitive. It will be competitive as every country, because you are not the local, and they prefer the local, as every country prefers. Even in a USA, you either needs to be like exceptionally good with that USMLE grade and stuff, and then you get, so that's the same story. GP positions, sometimes GP practices, they sponsor you guys in the area of need, and there it's like all good. There are some agencies that help in the hiring, and that it is. And did you ask about the visa types also or not? That's a different one.
Yes, sir. That brings us to the next question. What type of visa is required to move to Australia for an internship or medical practice? How early should candidates begin the visa and relocation process? And are there any relocation support services or government programs available?
Okay. Uh, you will not be allowed, like part one. I won't recommend you to come and give in Australia. It will be expensive. You can give it in now. It has opened in Pakistan. India has like I think a good number of centers. Sri Lanka do have. Bangladesh also have. Philippine have. So don't come to Australia. Okay. For part one, clinical, yes, you will need to come and again, it can be what you call those tourist visa or that kind of a student visa. I'm not good with this visa thingy, but I did a bit of research and found few things. So either it will be a common visa that's called temporary skills shortage visa (TSSS) 482, and that's from the clinical roles like some GP practices they can sponsor you, and you can come and do it. Or you can apply direct immigration 189 and 190 or 457 or 482 visa. Relocation, it all depends on you. You're married, you're single, or whatever. Uh, I think just start around 6 months to a year. That should be your good enough time to travel and relocate. Uh, Timing, it all depends on different visas and work. But yeah, you just need to be working with your employer and stuff. So do some health services, some bodies they do offer you relocation assistance, but I think it's usually around $5,000 or $10,000. But it will not. I don't think if your family or so for those $10,000 will cover you. But at least something is better than nothing. But not all. But some do sponsor cover it for you. Uh, there is no unified government relocation program, and again, it depends on the employer you're going to get.
Okay, sir, let's move on to the next question. What medical specialties are currently in high demand for IMGs in Australia? How competitive is residency training after completing the AMC pathway? And what are the realistic job prospects once a candidate clears the AMC and obtains registration?
So, in demand specialties, as I think you just give a little bit of Google search, GP there highly demand of GP practices like GP doctor, general physicians, because okay, so I'll just give you a little bit of how the work things work. So in Australia, like as from my experience in Pakistan, like anyone can walk to emergency center and they want to be treated in within half an hour. In Australia, you can't walk to emergency medical center, emergency hospital, emergency until unless it is really serious. Even if you go there, nurse will come and take you vital, then you ask the story, and then they will try out you. Uh, but so what happened? Like in Pakistan, there's like OPD of like every department. So they see, they come, they run the OPD, and then they accept the patient. But it's not like that. So what happens is everyone goes to the GP. GPCs try to cure it. If not, then GP will write a referral to the hospital. Hospital will see the referral, and then hospital will triage the referral. Like the urgent is in 30 days, then 3 months, and then 6 months. It used to be 1 year. Now they're reduced to 6 months. So once it is, then you will be called from the hospital, and then you will go and see. They will see you, they will check you, and all the stuff. And if they need it, then they will admit you. Okay. So that's how things work up here. So yes, there is hospital OPDs and stuff, but it's not like directly like you can't walk into those OPDs. So you need a referral from the doctor, and that OPD is like just run by the doctor GP referral. So they are trying to have too many like a good number of GPs. By this way, what they will do is like because GPs act as a gate or barrier to the hospital flows, so they just trying to slow down that patient transfer to the hospital. But in emergency cases, you can go to the hospital, like I went. So it will again. Then they will try it and stuff. GP, emergency medicine, aged care, mental health is a very big issue and very big field. So psychiatry, they are trying to do it. Rural medicine, it comes like in the same GP practice, but it's a bit different that you need to have a good hand with the surgery and stuff. So I would say GIT, oversaturated, cardio, oversaturated. Oversaturated, by oversaturated I means like when there is some reports comes from these hospitals, and we look on it, there's like 8, 10, or 12 cardiologists name written on the as their specialist or consultant name. So if by the time you guys will be on those specialists, the numbers would have like almost doubled. So try to find something new, or like maybe neurology and that kind of a stuff. So ophthalmology. So these are like, but GIT and cardiology is like oversaturated. I was or like saturated. So yes, there is competition in these specialties. Is competition is not like they don't want you. It's just because of their standards. And I just as explained to you guys like how beautiful their health system is. So it's just because of that they want to keep it a professional system, not to invite or like to lower their standards. And like once you get into the hospital, like you will be working for I think 3 years, and after 3 years then they will ask you where do you want to go. Either you want to take the GP pathway or you want to take the specialist pathway. GP pathway is shorter in the specialty because even the GP, to become a GP, you need to do the fellowship of FRCGP, Fellowship of Royal College of General Physicians, or rural medicine. And if you want to go into the specialist pathway, it is a bit longer, but in the end, you'll be a specialist or a consultant. Although, like GP is also a specialist, but uh, GP can't work in a hospital. Some GPs they do work, but they are not like the permanent employees. But they are like if you're working in a very far area or in a rural area, then yes, you sometimes you have to take care of hospital and the private practices. But in major cities, GPs can't work in a hospital.
Let's move on to the next question. What are the biggest challenges IMGs face during the AMC journey, and how would you recommend dealing with stress, burnout, or setbacks in this process?
uh, the common again challenges will be like because frankly, when I came to Australia, or like I didn't have an idea of big like Australia. It was only US, UK, US, UK, US, UK. Like so now it's like people are coming to know about, and there's like a lot of doctors moved from UK to Australia. It's just because we have got a very beautiful weather. It's not that harsh like UK. So Queensland, if you will check it, it's a very beautiful state. Like you get sunny days and a moderate weather, not that cold. And so come again like unfamiliar system, so there's not much information available, and there's financial stress because of the exam cost. If you have to come to Australia and you have to live here and you have to stay here, so that kind of a stuff. And then the culture adaptation and communication norms, they are very witty people. uh, but so you need to understand their wittiness and how they what's their system, or like how they communicate. uh, so if you took just to navigate these kind of situations, be connected with the people, try to find people who are working up here, uh, have a good communication, like Explore, LinkedIn, and these kind of there's a website Seek .com.au. These websites are like job application, LinkedIn, every like Queensland, New South Wales, New Sydney's New South Wales, Melbourne is Victoria, Tasmania is Tassie, so Darwin, Northern Territory. Go on their websites, their government websites, and see what's their system is, what they are looking for. So they will always what you call that display or like show advertise on the websites, and you can see it. But I would suggest you to make a try to build a good relationship and connection with the people, so it can, because knowing someone is always helpful in every part of the world. And you will feel stressed, you will feel burnout, so always give attention to yourself, to your mental health, and make yourself the priority rather than putting someone else or like some other thing as a priority. Because if you are healthy, then you can enjoy the blessings that God will be showering on you guys. Yes, Amal. Sorry, hopefully I didn't miss anything. If I did, do let me know.
Let's move to the last question. What inspired you to choose the AMC pathway? What was the most challenging part of your journey and how did you overcome it? And if you were to start over, what would you do differently?
I can speak on this for ages, I think. Yeah, keeping story short, frankly, at that time, uh, it was only UK, USA, UK, USA. No one knew about Australia. At least not my family knew it about it. Like in my part of area, we only knew about Australian cricket team, and so nothing else, nothing much. So one of my friend, his brother was already in Australia. He suggested let's go to Australia and become permanent resident in Australia in 2 years' time. And I said okay. Uh, I convinced my parents that I have to go to Australia. Uh, Luckily, I would say my parents they agreed, so I came to Australia. I came to Australia, I said in Perth. If yeah, so if I would start over, I would be uh, like starting study earlier, because this is a very competitive exam, and once you get into it, you will enjoy it. You will enjoy the perks and privileges that it will come with. But that's it. Yeah, like no complaints, bro. Like if I would have like become a doctor, I wouldn't be available for you guys to answer it. So as I say, like I was meant to be, and Allah Ta'ala said like there will be some students studying in a different part of the world. So it was written in my fate and destiny to talk to you guys, to talk to wonderful people like you guys, and that's it.
Thank you so much, Dr. Mohammad Ather Shafique, for sharing such valuable insights and practical guidance on the AMC journey and medical career opportunities in Australia. I'm sure our audience has gained tremendous knowledge and a clearer vision for their own pathways. Before we officially close today's session, Dr. Shafiq, I'd like to give you the opportunity to share your concluding thoughts, perhaps a final piece of advice or motivation for all the aspiring doctors listening in.
If you have to go, I'll try to make it short somewhere. But okay. So, firstly, do not trust anyone. Do your own research. Everyone cannot be trusted. Okay. So, be good with the computers. When you will come to this part of the world, there will be no spoon feeding. Okay. So, start eating by your own hand. That by mean, start doing your own work. You need to be good with the cooking. You need to be good with the cleaning. You need to be good with the laundry. I think you guys do it in the university, but you need to be with it, and you need to be good with the time management. Have a financial sense. like money management and financial understanding. Be good with the computer, not Facebook. Like you can, but not Facebook. You visit all the relevant websites. I'll also share with you that I'm compiling those some links, so maybe you can share with your group and your friends. Uh, AMC, EPRA, RACGP, RENS, RANs, ZCOG, that's for the gynae and obs, therapeutic guidelines. So, like, go through the specialty colleges if you're when you're studying for your exams and any question that's related to, try to go to their website and find a answer to it. There are many groups on Telegram which help with it. I wouldn't suggest you guys to be part of that group now because you will be overburdened with your studying for your own university exams. But uh, keep an eye on it and find those things. Uh, and do not expect more from the fans. Sometimes you have to walk alone, and it's not a trade. It's like you need to learn it. So sorry, guys. I know it's a bit bitter pill to swallow, but that's the reality. And open your intellectual and emotional doors. Don't be like going commander. I don't know how to say it in English, but don't be. Mm, you can translate it. Okay. uh Join IMG forums. Like there's a LinkedIn profile, there's Facebook pages. Start making your LinkedIn profile, keep it professional. Build your professional CVs and resumes, especially be the part of your research. Like because you guys will be applying from overseas for the jobs, you will not be like speaking for your own behalf, like after interview. So the more your name is on the research papers, the better it is. Be co-author, be if you're a main author, well and good. If not, be a co-author. Like the more you have, the more it is. And stay updated with the international guidelines. Things change, especially in this part of the world. uh, you do get new technologies and stuff, and there is no one fix for all. My Some people will agree to my suggestions, some will not. I'm happy for all of them. That those people who will not agree, I'm more happier for them. So because difference of opinion is the seed of the growth. So do your own homework, do your own research, don't stick to anyone's idea. And lastly, uh, enjoy the time that you have in your university. Frankly, I would do anything to go back to my those years and relive them, but I can't. This is the best time, kind of best time you are having. So make the most of it. But whatever you do, do it responsibly. You are all responsible human beings, and you have families and loved ones waiting for you. So just whatever you do, just think about them. And once you're out of these doors, boys and the girls, my fellows, you will miss it. Trust me, you will miss it. I hated my first year of the university, but I miss it now. So, yeah, I think that's all from my side, guys. You can find me, although my Facebook is deactivated at the moment, but you can find me there. You can find me on the LinkedIn also with the same name, Mohammed Ather Shafique. Uh, Insta, there is, but it's deactivated at the moment. So just try to live a life out of these things. There's a lot of things to do, a lot of skills to learn. And even if you're planning to come to Australia, learn trekking, hiking, bushwalking, so these kind of things.
Once again, thank you, Dr. Shafiq, for taking the time to guide our audience today. And thank you to everyone who joined us for this informative webinar. We wish you all the very best in your AMC journey and future careers. Until next time, take care and keep striving for excellence.